Pop quiz. A nurse is caring for a patient in the emergency department who's just been admitted with signs of a stroke, including right sided weakness, slurred speech, and confusion. Place the following nursing actions in the order they should be performed. 1. Obtain a stat head CT as ordered. 2. Assess the patient's airway, breathing, and circulation. 3. Check the patient's blood glucose level. 4. Establish IV access and begin IV fluids as ordered. 5. Notify the healthcare provider of the patient's status. Okay, so here's the order of what we're going to do. Number 2, that's what we're going to do first. Check the patient's airway, breathing, and circulation. Why? Nothing matters if they're unalived, right? So we need to make sure they're breathing. That's the first thing we're going to do. After we do that, we're going to check off number 3, assess the blood glucose level. And here's why. Sometimes, well, very often actually, hypoglycemia can present as a stroke. It'll mimic those signs and symptoms of a stroke. So you want to check and just make sure it's not a hypoglycemic reaction. So first we're going to do number 2, then we're going to do number 3. After that, we're going to do number 1, obtain a stat head CT scan as ordered. Why? We need to make sure, okay, is this an ischemic stroke or hemorrhagic stroke. So we're going to assess, we need information. After we do number 1, you're going to do number 4, establish IV access, begin IV fluids, give meds as ordered through the IV access. And last is called the healthcare provider. Why? You have to tell the healthcare provider everything that you did and the patient's reaction to it. Their vital signs, everything that happened, that's what you're going to report to the healthcare provider in order to get more orders. So you're going to be calling that healthcare provider last after you've performed your nursing interventions and done your assessments on the patient.